Ekene, thank you very much for finally we're not connected. Okay, so let's talk, not waste time. Please introduce yourself, tell my audience who you are and what you do.
Yeah, thank you so much, Ekene. My namesake. It's good
Yes.
to be here, finally. My name is Dr. Ekene Isikaku. I am Nigerian. I'm an Igbo woman. I live in Abuja, and I'm a public health specialist. I'm a medical doctor, and my special interest is in public health interventions. My work is that I oversee public health intervention programs in Africa, and currently I am the senior program field officer for Miraclefeet, overseeing the Clubfoot programs in 15 countries in West and Central Africa.
Okay.
That is
very good.
Me in a nutshell. Yeah.
Yes. So you mentioned you're a public health specialist. Now,
yes, please.
My audience may not know what public health means. So please enlighten us what that means.
Okay. Public health is a term used to address situations and conditions that affect a wide range of people, like an entire population. So it's not just like, oh, I have a headache, oh, I'm sneezing. So when 1 million people start sneezing, it becomes a public health concern. You remember what happened with the issue of COVID?
Yes.
Initially, there were news here and there, just some individuals, and then before you know it, it was declared a public health emergency
issue,
because many people now had it over a short period of time. So public health is just basically a situation, a condition, a health disease or whatever that affects the general public. In the same way, the solution to that problem will also, when applied to that general public, you get the same results.
Yeah.
You understand? So
yeah.
That is it in a nutshell.
Okay. So what kind of programs are you working on in public health area?
Okay. In the past, over the past, let's say 10, 15 years, I've majorly focused on HIV programs, HIV and AIDS, malaria and TB programs. I'm sure those are the common ones you also know about. Different government is interested, different interest groups, different individuals and non-governmental organizations, and a lot of successes have been recorded. And then recently, I joined Miraclefeet to supervise their Clubfoot program, and I realized while on the job that it has not really been publicized. It has not gotten the recognition and the awareness it so deserves, because Nigeria currently ranks number 3 on the Clubfoot board in the whole world, after Pakistan and India, I think. Yes, and every year over 10,000 babies. Every year over 10,000 babies are born with Clubfoot. I want to say something about that so that I don't forget. It might seem uncommon. Clubfoot seems uncommon, but to that one person that has Clubfoot, to that one family that has the malformation present in their family, is a big issue. And when they grow up, because the intervention is so easy, it's so sad and so unfortunate that if the baby does not get treated, when they grow up, they live a whole life of discomfort. They live a whole life of discrimination, stigma, and all whatnot. So I'll still get the opportunity to talk more about that, but that is what I'm focusing on right now.
Okay. Now, what do you call again?
Clubfoot.
Okay. Tell my audience what that condition means. How is it manifested?
Okay. Clubfoot. Perhaps you'll also eventually show them a picture. Clubfoot, as the name goes, the clinical name is congenital talipes equinovirus. It is, by the name, it is when a baby is a congenital anomaly. When a baby is born and the baby comes out, he shows up with his foot curved downwards and inwards, like this.
Yeah.
Like the club, you know, the golf club.
Yes.
The head of the golf club, that one that hits the ball, you can see how it's curved. That is exactly how
Clubfoot.
So,
now it make more sense to me. Okay.
Exactly. Some communities in Sierra Leone, for instance, and Liberia, they call it turtle foot. You also know that the foot of the turtle is also called, and the way he waddles.
Yeah.
Yes. So that is what it is. it doesn't have any known costs. We have not really been able to say this is what causes it. There's just been speculations about the risk factors. Some say maternal smoking, some say when the amniotic fluid in the uterus is very minimal and it causes some form of compression. Nobody really knows the cause, and that is how it's difficult because you cannot prevent it. Assuming you knew the cause, it will be highly preventable. So what we just do is to run programs to treat it and to support the family towards its rehabilitation over a few years so that the baby can have their balance.
Wow.